Hi, it's Dr. Artie Kavanaugh coming to you from ACR 2023 Convergence in San Diego. Lots of good abstracts and posters presented and on a lot of important topics. I want to talk about one abstract, 387, and this looks at the potential role for high sensitivity cardiac troponin T and cardiovascular events in rheumatoid arthritis. So this is from the longitudinal cohort of RA patients, and it deals with an important issue, that is which of our patients might have a greater risk of having MACE events. This was brought to the forefront by the oral surveillance study most recently, the 1133 study, where it seemed that there may have been an imbalance with different treatments and the occurrence of MACE events, particularly in people who had risk factors, people over than 65, people who had ever smoked, people with established cardiac risk factors. So in this analysis, what they did is to look at highly sensitive troponin T as a marker potentially of cardiac injury. It certainly is something that our colleagues use to identify people who've had actual damage, such as a myocardial infarction. But if you look more carefully, you'll find that quite a number of people may have elevated levels. Do these have any prognostic significance? Well, this abstract looked at that and said that they may. So if you have people who have detectable cardiac troponin T, the highly sensitive one, so more people will have it. I think in this cohort they had about 30% of people who did have that. They indeed seem to be more likely, even adjusted for other cardiac risk factors, to suffer MACE events. So is this something we're going to see measured in the future? Might it be measured as part of clinical trials to more specifically delineate cardiac risk? We'll have to see. But it was an interesting idea, and I think a well-done abstract and important information. So this is Dr. Artie Kavanaugh coming to you, ACR 2023 Convergence.